Welcome back to Healthy Living. Whatever your age, whatever your experiences, whatever you do, your health as a woman should be the most important thing to you. Going to the doctor for female health issues can seem mortifying, whether you're doing a pap smear or breast cancer test. Dr. Mbele shares more on women's health concerns. We're still with Dr. Mbele, and we're going to discuss the different stages of a woman's life and what they go through when it comes to their health. Dr. Mbele, thank you for staying with us.
Yeah.
As we mentioned, the different stages, you get the ones that are prepubescent, you then get the puberty stages in the teenagers, into the late teens, and the different stages thereafter. What are the common changes that happen in a woman's body, and are there any concerns at particular stages that we should be aware of?
It varies depending on population, but the most important thing that we as parents and as clinicians, we should discuss with our female, should I say, children.
Yeah.
Yeah, it's actually we should have that sensitive discussion about the use of human papillomavirus vaccination, because it is important to vaccinate these children before they are sexually active against human papillomavirus. Human papillomavirus is the main cause it's actually the cause of cervical cancer, yes. So it's important that we should talk to them about that. And also just educating your children at that age to actually avoid weight gain. It's very difficult to lose weight once you've gained it at that age. Just promoting a healthy eating habit. I don't know if the kids can train at that age, but we should encourage that.
Yeah.
Yes.
They can play. The kids can play and have fun and keep moving in that way. I think that's relevant for them.
Yeah.
Because we can't take them to gym. They're going to hurt themselves and get bored.
Yes.
And then the next stage,
once they reach puberty, they start to see their periods, and then some children that are predisposed to endometriosis, they start to develop those severe menstrual cramps, which the parents are frustrated. They can even miss school. So it is important that at that stage you can take your teenager for evaluation of the entire female genital tract, and then they can be evaluated if they may have symptoms and signs of endometriosis. They're also prone to develop these irregular menstrual cycles because the brain is not yet matured to control the menstrual cycle. They can develop cysts, and that's a stage where we should start discussing contraceptives and the role that they play. And if they happen to be sexually active, we should start discussing re-emphasize pap smear, screening for cervical cancer. If they're not sexually active, again, you continue with the discussion on HPV vaccination. Then above 20 years, let's say between 20 and 40, that's a reproductive age, then it is important for women to see they can see a GP for a pap smear every year. And if they've got family history of breast cancer, they can start to be taught breast self-examination. If they pick up any lesion, they should consult so that they can be an early diagnosis if there's anything about breast cancer is made. Again, it is important because now they are in their reproductive age. They should be on supplement. They should start supplementing, especially with folic acid, to prevent neural tube defects between that age.
Wow, so there's quite a bit in that stage to look at.
Yeah, that's when a lot is happening. Again, there's something that we tend to underestimate. They go through a lot of emotional. So mental health should be attended to, because a lot of females tend to have this underlying depression, which is mostly undiagnosed. So it is important that all clinicians should actually do a quick assessment of the depression levels. There's other things like they should exercise. Women, once they gain weight, it's difficult to lose weight. As I said, they must do a minimum of like 30 minutes per day of exercise, sleep at least for 7 hours per day. I don't know if that's possible for most of the students, but it is advisable.
Doctor, you've mentioned contraceptives quite a bit now. If a woman has been on contraceptives from her teenage years into reaching the reproductive years, let's say about 25, 30, they will now start having children. Surely those contraceptives would have, affected their bodies to a certain degree. What would your advice be to wean them off the contraceptive to allow them to fall pregnant? And what if they want to go back onto a contraceptive after giving birth?
Okay, so there are different contraceptive methods. It is important before you start any woman on contraceptive to discuss why do they want to use contraceptives, how soon will they want to fall pregnant, because we've got oral contraceptives, we've got injectables, we've got intrauterine contraceptives. The oral contraceptives, most women usually fall pregnant within 3 months after stopping those. Injectables, most women will fall pregnant within 6 months to a year. That's very important. Well, intrauterine contraceptive devices, within a month to 3 months, they can fall pregnant. So, do contraceptives have an impact on your body? Of course, they have an impact on your hormones, on the female's on the female hormones, but that is short-lived. You know the drugs, they've got a half-life, but some contraceptives can sort of be associated with weight gain, and especially the injectables. I forgot to mention there's a new contraceptive, the transdermal,
yes,
the implanon, that also has got an impact on women's weight. So it's an individualized discussion. I cannot generalize and say this is how it should be done. So it's individualized. The clinician must discuss with each patient and discuss the goal of using contraceptives. How soon do they want to fall pregnant? Yes.
Doctor, that's amazing to know, and I think that the golden ingredient that you've mentioned is to be active.
Yes.
Throughout your life. And I think this is universal for the women and the men out there, but more so for women that go through a lot of these hormonal and physiological changes as they age. Doctor, what are your final few tips for women out there when it comes to looking after your health to be the healthiest woman that you can be?
I think let me start from this phase that we're at. The discussion about the use of hormone replacement therapy, it's actually must also be individualized. I mean, we commonly say women needs hormone replacement therapy if they are symptomatic because they've got side effects. So above the age of 50, get active, exercise, sleep enough, and have your yearly visits with the specialist. Between the age of 20 and 40, have planned pregnancies. It is important to plan your pregnancies and even the number as well, because that's the time that women have to balance their careers versus a family. So it is important that a woman must stick to a certain program at that stage. A 30-minute walk every day, sleeping for 7 hours, screening every year for all these conditions that we talked about. Less than 20 years, discussion about HIV, STDs, and contraceptives. Prepubertal vaccination against HPV.
As simple as that. Simple tips for every phase from a young child into a young woman, into an older woman going through different changes. Yes. Doctor, thank you for your time out of your busy diary and for joining us on Healthy Living.
You're most welcome.
What great advice we received from Dr. Mbele that gives us insight into helping women look after their health. But speaking about looking after your health, exercise is an important component thereof. Why don't you join us for this week's exercise routine? There's no use in exercising if you're doing the exercises with the incorrect technique. Incorrect technique means you're working the wrong muscles, or even worse, you're risking injury for yourself. So let's go through the top 4 multifunctional exercises that are out there that anyone and everyone should be doing, and what are the incorrect ways to do it, and then fix them up to show you, our Shape Your Life viewers, how to do them correctly. The first exercise is the squat. So I have the ladies here going into a squat position. Ladies, let's have a look at your squats. Are you ready? Go for it. Now, as you can see, I have 2 variations here of the squat exercise. Over here, I have Stacy going down really low. If you notice, her buttock is dropping below her knee. To fix this exercise up, Stacy, what I want you to do is imagine you sitting on a chair and do not bend your buttock below your knees. Go for it. So just there and up. Just there and up. Now, what that does is it protects the knees. So you're not going to risk any injury on the knee area, and if you do have poor knees, it really helps strengthen the supporting muscles around it. All right, now Boosie is doing some sort of variation on the squat. You'll notice she's leaning too far forward, which puts way too much pressure on her knees, but also there's no effect on the quadriceps or the hamstrings. So Boosie, what I want you to do is lift your back upright, not at 90 degrees, slightly forward. Imagine you sitting back onto a chair. That's it. And up slowly. Good. Bring it down. Now there's a constant focus on that front thigh muscle, on the hamstring and on the buttock. She's not bending too low, and she's maintaining a good back posture. By not bringing your back upright at 90 degrees, you really are protecting the knees and maximizing the effect on the legs. Keep it going. All right, moving on to our third exercise, the push-up. The push-up is known universally as being one of the most phenomenal exercises you could ever do. Now, many women think they can't do it because they don't have upper body strength. Ladies, try this exercise, and we're going to show you the 2 variations, the basic with your knees on the floor and the more advanced one with the knees not on the floor. However, if you do it with the incorrect technique, we're here to help you fix that technique to ensure that you maximize that effect on the upper body. So, Stacy and Boosie, show me your push-ups. Let's have a look at what Boosie's doing. Now, you'll notice here that Boosie's buttock is up. So what it does is it takes away the effectiveness of the exercise on the upper body. So Boosie, stop it there for me. What I want you to do is take your hands a bit more forward, hands a bit wider, drop your hips down so that your shoulders are in line with your hips, in line with your knees. So it's a straight line over there. And already you can feel there's a lot more weight on your shoulders, right? Now I want you to bend the elbows down and push it up. Good. All right, so far so good. Let's go over and see what Stacy's trying to do. Stacy, are you doing yoga or a push-up? Okay, here's what I want you to try. Keep your hips in line with your shoulders so your back is fairly flat. Now I want you to bend the elbows halfway down and engage your core. There and up. Now you'll notice with this exercise, many people drop their hips down and raise their shoulders. You're not working your upper body. You're literally working nothing. So by doing it this way, you maintain the effectiveness on the upper body, tightening those shoulders, the chest and the triceps. But of course, with the correct technique, there's more weight, and this is what you want to try and do. All right, our last exercise to fix today is one that we have done since we were in primary school, and that's the sit-up. Now, the sit-up is one of the exercises that 90% of people out there do incorrectly. When you ask them, what ab muscles do you need to work when you do the sit-ups, they say, no, all the abs. They don't realize it works one area of the abs, but with the incorrect technique, you put a lot of strain on your neck and on your shoulders. Let's have a look at some of the wrong variations and try to show you the right technique for the sit-up. Ladies, are you ready? Into position. Show me your sit-ups. All right, we've got 2 distinct variations here of incorrect technique. As you'll notice here with Boosie, she's lifting her chin to her chest and keeping it there, putting a lot of strain on her neck and her shoulders. And throughout this exercise, she's raising it too high up, which means she's not getting an effective ab workout because the range of motion is too big. Here's what I want you to try. Bend those knees. Hands go below the knees over there. Straighten the elbows. All right, lean back and roll the fingers over your knee. Chin up over there. What I've just done now by fixing the technique is literally helping her engage the core, tighten the abs by going up and going down by limiting the range of motion and lifting the chin up so there's no pressure on the neck and the shoulders to ensure that the abs get a workout. All right, now let's go over and see what Stacey's up to with her ab exercise. Now, as you can see, Stacey's lifting behind her head with both her hands and literally pulling her head up, working her neck rather than her abs, and dropping the chin down, which is incorrect. So Stacey, here's what I want you to try. Put the hands on the chin, lift the head and shoulders off the floor. That's your starting position. So as you can see, if I put my hands there, she's not laying down. That's your starting position. The abs are already engaged. Lift up slightly and drop it down slightly. This is called a mini ab crunch, a mini sit-up crunch. So this is a variation that you could utilize to really give constant tension in those abs and really work them. But you've got to keep on going with the repetitions throughout the 60 seconds to get an effective workout. There's very little pressure on the neck and by dropping the chin down, so the abs become the focus area. That's all we have for you today on today's show. Thanks for watching Healthy Living on Afro Worldview. From me, Ronald Avergy, and the team, keep warm and healthy. Cheers.